condition.
Hello, I'm Dr. Phillips. I want to start today by speaking directly to women who have been told perhaps by friends, family, or even other doctors that intense menstrual pain is just part of being a woman. There is a biological line between discomfort and disability. If your period forces you to cancel plans, stay in bed, or miss out on your life, it is not normal. Today, let's talk about why that pain happens and when it's time to take action. To understand if your pain is abnormal, we first have to understand what normal looks like. During a period, the uterus contracts to shed its lining. This is caused by chemicals called prostaglandins. A little cramping, that's the uterus doing its job. Normal pain usually starts a day before or on the day of your period and fades by the second day to third day. It responds well to simple heat or basic over-the-counter medicines. Abnormal pain, or what we call secondary dysmenorrhea, is different. Ask yourself, does the pain start days before the bleeding? Does it last the entire week? If you find yourself taking the maximum dose of painkillers and still feeling like you are being twisted from the inside, that is your body alarm system going off. The three most common culprits of abnormal pain when a patient comes to us with extreme pain, we look for three main conditions. First, endometriosis. It is a condition where tissues similar to the lining of your womb starts growing in places it does not belong to, like your ovaries or pelvic lining. Every month, these misplaced tissues bleed, but it has no way to leave the body, causing intense inflammation and scarring. Second is fibroids. These are non-cancerous growths in the muscles of the uterus, smooth muscles of the uterus. Depending on their size and location, they can make the uterus contract much harder than it needs to, leading to heavy bleeding and pressure-like pain. Third one is adenomyosis. This is often overlooked. It happens when that inner lining grows into the muscle wall of the uterus, making the womb feel heavy, tender, and enlarged. It's actually very excruciating pain. Understanding this isn't meant to scare you. It's meant to empower you with the vocabulary to talk to your specialist. Why does it matter if we ignore this? Why not just tough it out? Aside from the mental and emotional toll of living in chronic pain, untreated conditions like endometriosis can lead to complications like infertility or chronic pelvic pain that stays even when you aren't on your period. I often see patients who waited 5 or 10 years to seek help because they thought it was normal, as they have been told. The sooner we diagnose the cause, the more options we have to protect your long-term health and your future fertility. What are the options we explore medically to address your chronic menstrual pain? We start with a conversation. We look at your pain diary, tracking your cycle, the intensity of the pain, and any other symptoms like heavy flow or pain during intimacy. From there, we might use a pelvic ultrasound or, in some cases, an MRI, that is magnetic resonance imaging, to see what's happening inside the body. The goal is a personalized roadmap. For some, it's hormonal management. For others, it might be minor procedure to remove a fibroid. The point is, there is a roadmap and there is a solution. At Guinea Savannah Medical Center, we don't just treat symptoms, we treat people. Women's health is a cornerstone of a healthy society. And you deserve to live a life that isn't dictated by a calendar. We provide advanced, compassionate care for complex gynecological issues. You've carried the burden of normalizing your pain for too long. Let us help you find the relief you deserve. I am Dr. Phillips.